You want to know what's become way too normalized in society? Being exhausted all the time. Women dragging themselves through the day, thinking it's normal to have brain fog, anxiety, no energy, low sex drive, poor sleep, zero motivation. Men thinking it's normal to feel flat, burned out, disconnected, and for both, they're told their labs are fine. Hormones deserve so much more credit than society gives them. Just because your body just stops randomly talking to you, symptoms are your communication, and you deserve to feel good, not to feel functional. Here's what most people don't realize. Lab reference ranges are not created from the healthiest people walking around. They're created from large populations, and that includes people who are obese, insulin resistant, inflamed, stressed, and some people not even diagnosed. So right away, normal. What does that actually mean? It doesn't mean optimal. And research in clinical chemistry has shown that most people function in a much narrow range versus a broader population range in reference to normal range, meaning your body feels best in a very specific zone. Even if your labs fall inside the range, you can still feel awful. And if you're outside your normal, I'm here to validate you. You're not crazy. You may just be far enough outside that population range to be put with what's in normal to flag it. It's like saying, what is the best temperature for your thermostat? People feel most comfortable at different ranges, and the same is true for your lab ranges. The lab itself can change the answer. Here is another thing most people do not know. Reference ranges are not standardized. So while one lab might call something normal and another lab might call something abnormal, same blood, same patient, different story. Testosterone is a perfect example. Some labs use lower cutoffs as much as 144 nanograms per deciliter, while others might use 300 nanograms per deciliter. That is a huge difference. One provider says you're hypogonadal, another one says you're fine. And by the way, hypogonadal is just a fancy word for saying you're not producing enough testosterone. Hypo is low and gonadal refers to the testes. And that's it. Your engine is still there, but your fuel is low. And that can show up with those symptoms that we talk about: fatigue, brain fog, low motivation, central abdominal fat, weight gain, insulin resistance, sleep deprivation, and feeling like a completely different person. Even research published in the Lancet questioned how reliable those commercial testosterone ranges were, because so many were built from using random, non-standardized blood draws. The total testosterone is not the whole story, and this is one of the biggest mistakes in hormone medicine. Most patients get a total testosterone check and they're told they're normal, right? But the total testosterone alone does not tell the full story, not even close. And most testosterone in your bloodstream is attached to proteins. A large amount is tightly attached to what we call sex hormone binding globulin, which is also known as SHBG. Think of it like a seatbelt. If your testosterone is tightly strapped to that seatbelt, it can't enter those cells easily and do its job. One small percentage is free testosterone, and that is the active form that is available to your tissues. So you can have two men and even women at the same total testosterone level, but one has a lower SHBG, the other one has a higher SHBG, and they can completely feel different, have a different story of symptoms. That can change the whole picture. Why? Because free testosterone levels, while the other one has most of the testosterone locked up to that SHBG, the other one doesn't. The Endocrine Society specifically recommends evaluating free testosterone in patients with altering conditions that might affect their SHBG, whether that be the insulin resistance, obesity, type 2 diabetes, aging, thyroid disease, liver disease. Those all factor in. And sometimes when you go and get your testosterone levels, they only see the total testosterone. They do not do that deep investigation. And that's where total testosterone can be misleading. Research from the European Male Aging Study showed that men with low free testosterone had symptoms regardless of their total testosterone level. What does that tell you? Meanwhile, some men with low total testosterone but normal free testosterone had no symptoms at all. So the hidden factor here is that SHBG, and that variable can change everything, especially when it comes to hormone optimization. What affects SHBG? That's what matters clinically. Things that lower it could be obesity, insulin resistance, type 2 diabetes, hypothyroidism, steroid use. And when that SHBG is low, total testosterone can appear low, even when free testosterone is adequate. And that's what we call pseudo hypogonadism. It's basically a false alarm. Now, things that can actually raise it is aging, hyperthyroidism, liver disease, estrogen therapy, certain medications. And when that SHBG is high, the total testosterone may look normal while the free testosterone is actually low. That patient feels terrible, but the lab says they're fine. And this is where, again, the number alone does not tell the whole story. So when your SHBG is high, total testosterone may look normal, while the free testosterone is actually low. The patient feels terrible, but the lab says they're fine. Again, the number alone does not tell the whole story. And that's why at Vital Forge, we focus on the root cause, not just the lab number. We look at the full picture, whether it's your hormones, your lifestyle, stress, sleep, inflammation, metabolism, nutrition, and how you actually feel today. Because everything looks normal does not always mean you feel well. We believe your symptoms deserve more than a 5-minute conversation instead of just saying and concluding that your labs are normal. Your body is talking, and sometimes you just need the right provider to help you connect the dots. Testosterone in women, the conversation that nobody is having. Most people think that testosterone is just for men. That's simply not true. Women produce testosterone too, and it affects similar symptoms, just enough to affect our energy, our mood, our muscle, our libido, our bone health, and our metabolism. The problem is women produce testosterone in smaller amounts, and most standard lab tests were designed for male levels, meaning many common hospital assays are not as sensitive enough to actually measure the female testosterone levels. The Endocrine Society has acknowledged this. Sex hormone binding globulin matters also in women too, maybe even more. Women naturally tend to have higher levels of SHBG, which means that we have actual less free testosterone that is available to our own tissues. And so when a woman technically has a normal testosterone level on paper, her free testosterone is actually extremely low. And when we get through peri-menopause or postmenopause, those levels start to naturally decline. She's exhausted, her libido has worn off, her mood is flat, her muscle strength is low, and she goes and gets checked and she's told, hey, your hormones are fine. Sometimes the problem is not the patient. The problem is the testing. And to be honest, currently there is no universally agreed upon testosterone cutoff, and that defines it for women. The research and reference ranges are still evolving till this day. Thyroid has the same problem. Thyroid medicine runs into the same exact issue. Research was actually supported by the American Thyroid Association, found that thyroid hormone levels vary much less within an individual person than they do across the general population, meaning your personal thyroid range might be much tighter than the lab's population range. So you can shift enough to feel symptomatic while you're still technically normal. A 2025 study in the Annals of Internal Medicine showed that adjusting thyroid ranges for the age, the sex, race, reclassified nearly half of previously labeled subclinical hypothyroid patients. That is huge, and it shows how imperfect population ranges really are. Women get dismissed the most. And honestly, women experience this constantly. Perimenopause can start years before menopause officially happens. Sleep changes, anxiety appears out of nowhere, joint pain, weight changes, brain fog, mood swings, hot flashes. And your brain is so sensitive to those hormonal shifts. And many women are told, well, your labs are normal. But hormone fluctuations perimenopause are dynamic and inconsistent. It's like the chaos before the storm hits. And you are trying to capture a moving target in a single blood draw. And research still shows we do not have fully standardized reference ranges for any female reproductive hormones. That means many women are being dismissed based on incomplete science. And if I'm being fully transparent, early in my career, I didn't know much about it either. But the more I listened to women, the more I saw what they were going through clinically, the more I experienced it myself, I knew that we were often being dismissed. And that's completely how I changed my practice. Bottom line, a reference range is not a treatment plan. Labs should not guide your clinical judgment and replace it, because sometimes you do not have a hormone problem. Sometimes you have a diagnostic problem, and normal does not always mean optimized.